their life or fearing for being, shelled or not having food tomorrow doesn't give people alopecia areata more than, in the U.S., then indeed stress has very little to do with the pathogenesis.
Yeah, understood. That's a good analogy. In terms of diagnosis now I know you're obviously at a different level than the community dermatologist, but how does one typically diagnose AA and then determine disease severity? What tools or scales or other things are generally used for diagnosis?
It's largely a clinical diagnosis, meaning somebody comes in, you look at their scalp or their body hair, and you see mostly round circles of hair loss, and you say, haha, that's alopecia areata, and then rarely or uncommonly you need a biopsy because you're just not sure. The pattern maybe looks a little bit like alopecia areata, but it might be explained by, kind of male pattern or androgenetic alopecia, and therefore you do a biopsy to be sure. But it's usually just the pattern that tells you the diagnosis.
Okay. And are there any other, like we've heard about, like hair pull, we've heard about exclamation point hair, we've heard about, those couple of things. Are those fairly characteristic, or are they, other components of it?
I mean, there are things that kind of people like to talk about it, and something else is on. With a magnifying glass, you can see, quote, yellow globules in the skin. These are things that you see in textbook chapters and reviews of alopecia areata. I would say the moment at which somebody is relying on a hair pull to make a diagnosis, I think that they're probably, if they weren't certain of the diagnosis before they did the hair pull, they're probably doing a biopsy also.
Okay.
So these are little things that make for resident teaching and med school teaching, and they sound nice in a lecture, but relied on to make a diagnosis of alopecia areata. If you see, the idea being that, if you see a round spot with exclamation point hairs, haha, it's alopecia areata. But the truth is, all you needed was a round spot. The exclamation point hairs, kind of make for a nice couple of sentences in a review article, or kind of help to teach the med students, but probably not helping you decide that somebody has one form of alopecia or another.
Okay. So it's not a complex diagnosis then. It shouldn't be a difficult diagnosis.
It is not 90% of the time. It is really straightforward.
Okay. That's great to know. Now tell me about the typical, we're going to just shift to the typical patient treatment journey for AA. And I know in your case you're treating more severe, but maybe if you could also help me with, starting with mild to moderate to severe, or if it's just mild and severe, if we want to go there. What are the typical treatment plans, just in terms of treatments used, what factors inform treatment choices?
Sure.
Go ahead.
Sure. So for a reasonably small amount of scalp hair loss, although for sure there are plenty of people who have gone in and had literally their entire scalp injected with Kenalog, which is steroid. But that's relative these days, especially fairly uncommon. But